name is Anthony. I'm going to be deaccessing your Metaport tubing today, so your Metaport line. So before we start, I just wanted to check your name and date of birth on your wristband. Looks good, checks out, matches the MAR. And again, I wanted to make sure you were in a good, comfortable working position. You were fine with me doing it in this position. You're good. Any pain that I need to be aware of? You're good. Okay, perfect, awesome. So I'm just gonna go ahead and get started, and I'm gonna use my general principles and safety practices throughout the procedure. So I'm gonna perform hand hygiene, and I'm gonna put on a pair of gloves. All right, and ma'am, I'm going to just use this swab here to clean the hub of that line real quick, okay? So I'm gonna come over, I'm going to remove this cap, right? Scrub this hub vigorously, right? Okay? And then I'm going to let that dry. Once it's dry, I'm going to take my normal saline that I have here as a flush. I'm going to put that in there. I'm going to unclamp the tubing, and then I'm going to pull back to make sure there's a blood return. Okay. Once I have that, see blood return, then I'm going to use a pulsatile motion to administer the normal saline with about 1 milliliter each motion. Perfect. All right. So now that we have that, I'm going to put this to the side. I'm going to take another antimicrobial swab. I'm going to act like this is a new one. I'm going to scrub the end vigorously once again for about 30 seconds, and then I'm going to let that dry. I'm going to discard that. Once it's dry, I'm going to take this heparin that I'm going to use for the heparin lock. I'm going to put that on the end of that right there, and then with the same pulsatile motion, 1 milliliter each motion, about administer that. Okay, perfect. So that's all done. And then I'm going to just clamp this tubing again so there's no backflow. Perfect, okay. So now I'm just gonna remove this dressing, all right, ma'am? So I got some gauze here, and I'm gonna remove the dressing and check for any kind of, anything we should be aware of. So I'm gonna remove it from the outside inward, right? Right, outside, inward, perfect, okay. Then I'm gonna discard this. I'm going to assess the site for any kind of redness, drainage, leakage, anything like that. Nothing like that. Is it painful at all? No pain? Perfect, okay. So I'm just going to remove it now. And to remove it, I'm going to use my left hand, which is my non-dominant hand, to stabilize the port. So there should be normally it's about 3 prongs in like a triangular position. I'm going to put my fingers on that to stabilize it. I'm going to use my dominant hand position on the wings of the port, and I'm going to remove it at a 90-degree angle, and then I'm going to use the safety and discard it in the sharps container. So I'm going to put this, engage the safety and put it in the sharps container. Okay, now for the site, I'm going to take some gauze, and I'm going to, if there's any, I'm gonna dab and sort of soak up any kind of discharge that may be present. Doesn't seem like there's anything really there. No pain, ma'am? No pain? Okay, awesome, looks good. So I'm just gonna throw this away. She said there's no pain, but I'm gonna return maybe 15-30 minutes to make sure she's doing okay, there's no complications, and I'm going to just remove my gloves, clean up, perform hand hygiene, and report and record.